Hello and welcome. This is Deepak Mishra once again, and today we have Dr. Vikas Sandilya with us again, where he is going to share his journey as a appropriate dentist. Now he is an appropriate dentist. We have another video where we have shared the details about exam pattern, preparation strategy, how difficult the exams are, different aspects of the exams. Now in this video, we are going to talk about life as a dentist. He comes from India. He has done his graduation, post-graduation in India. After that, he has worked for some years in India, and now he's working in Germany since some time. Hello, Dr. Vikas.
Hi, Dr. Deepak.
So, first of all, once again, many congratulations for passing the exam.
Thank you. Thank you.
On this opportunity, we don't make videos very often. We make videos on certain milestones. You achieved a milestone of Fachsprachprüfung. We made a video. We talked about that to many. Talked about that and shared information about the exam. Now you have passed your Kenntnisprüfung, and now you are a full-fledged dentist working in Germany. Yeah. So now what I wanted to know from you, and many candidates, many viewers who are dental professionals and plan to work in Germany in future, would certainly like to know that how is the life of a dentist in Germany, the work life? What kind of work do you do? Can you tell us how many clinics, what has been your work experience in Germany so far?
I have been working for the last 1.5 year roughly here in Germany. Work experience, luckily for me, has been like most of it very good. Right. I worked in my first clinic for just a couple of months and then had to leave it for some reasons. But the my present workplace is I have no complaints like at all. That it may not be the case with everyone, but uh, it's pretty good. So life is good as a dentist here. The work environment is good, and it is very important to have supportive, friendly staffs. So in most of the clinics you would have uh, usually staff which are friendly and supportive, because right now they also have accepted the fact of foreign dentists and foreign people working here in the dental industry here in Germany. So it's not as seen as like that nowadays, that okay, who are they and where have they come from, and they are foreign trained dentists and things like that. So you are pretty much part of the system then. So you don't feel uh, alien to them, right? So it's pretty much natural. You feel at peace, kind of, right?
Yeah,
So
but
if
once the language burden is like language hurdle is overcome, after that you feel like that. I hope.
definitely,
Yes.
definitely. So it takes time. So don't worry about that. It would take time, even if you have come with a B2 from India, and you have even passed the Fachsprachprüfung. Fachsprachprüfung definitely is a milestone in itself. You definitely feel confident about that. But it would take time. So just allow yourself that time, and uh, don't be anxious, and don't trouble yourself too much. It will just come with time. There's just no substitute to it. Keep working on it, be interested in it, and it will naturally come.
Okay. So,
Yeah.
Dr. Vikas, when you go, how is your work day? When you go to work, what time do you start working? And till what time do you like work every day? Do you have to work on weekends or nights? Or how is that? Nights, I don't think.
No, no,
You don't
nights
work.
are not there
That
as
is the
a general.
privilege of surgeons and
Yeah,
other
as a
doctors.
general dentistry, yeah. Luckily, we don't have to do that. So the work timings are really very regulated. This is a huge, huge difference, I would like to say. I used to work in India in a dental chain in Delhi, and it was a corporate chain, and I used to work on weekends too. And it was I'm married, so my wife used to have offs on Sundays, and I used to have offs on Wednesdays. So
Okay.
it was very difficult to manage things together. So we that was the issue in India. Like you don't have much time on your hands, right? So that was our issue. Here I have 4.5 days of working. Not only I, like most of the dental clinics, they are 4.5 days working, uh, either from Wednesday or Fridays, depends from region to region. They work for half day, and then the other 4 days they work for full days. So the clinics here start early in comparison to India, where they may be starting from 9 or 10 a.m. Here they start from 8. I have even seen people starting from 7:30. Not all of them, but at least one or two. But our work timings are really good. The patient inflows are usually also very good. Like on an average, it depends from clinic to clinic, but the average work in an average clinic here in Germany, what you do is definitely more than an average clinic in India. Average, I mean, there are always different types of clinics everywhere, but the average amount of patient inflow, because the competition is less, just to say here, right?
Mm-hmm.
So there are many dental clinics in India, so it naturally gets distributed overall. But here, that being less, you don't have to do much to get patients. Basically, patients just come to you. If you are just treating them properly and you are behaving with them properly, they are just coming to you. You don't have to do any extra, so to make too much of extra efforts to get patient inflows. So
Okay.
yeah.
All right. And so salary wise, how is what are the stages of financially? What should an aspirant expect salary wise at different stages of their career?
Yeah, so with Berufserlaubnis, as one is working, you can expect it in the range of about 2,500 euros starting to up to, it depends from clinic to clinic and upon your work experience. But I would say if you are up to the range of 3,500 euros brutto, uh, it's pretty okay with Berufserlaubnis. Like
Okay.
you, above that would be difficult to get. I'm not saying impossible, but would be difficult with Berufserlaubnis to get that. But this is the usual range. If you're getting 3,500, you are actually um, in the upper fraction, to say. Like the most of the people are not getting 3,500. And with that, you may have the possibility of Umsatzbeteiligung. It depends what kind of contract you have with your boss. Umsatzbeteiligung is something that you and your boss will sit together and you guys will decide upon a certain amount, uh, depending upon your salary. For example, if your salary is 3,000 euros monthly, you may come up to an amount of 12 or 13,000, which would be fixed as your upper limit. And whatever you earn above 13,000, 20 or 25% of that commission would go to you. Like whatever you have generated. If you have earned 18,000, that means
When you say
5,000 more.
earned, I have not have not understood this part very clearly. So for the benefit, I mean, I know this part, but still for the benefit of the
Yeah.
audience, um, when you say that from the turnover, you mean, right?
Yeah, I mean the revenue that you have generated for the clinic,
Okay.
like the work that you have done and the revenue that you have generated from it. So that would be, there will be a upper cap to it. A cap would be put to it.
Mm-hmm.
And that this upper limit or this cap is decided on how much your salary is, basic salary.
So that means if
Yeah,
someone is earning, say, 3,000 euro as a brutto,
yeah,
then he might have a cap that till, say, till 12,000,
yeah,
he will not be paid extra.
yeah,
But after that, then there is a fixed like percentage that can be fixed that, okay, if someone is
yeah,
very hardworking and doing lots of work and doing lots of patients. So each patient that is seen under the name of that dentist.
exactly, exactly.
Okay.
That's how
Okay.
it
So,
is.
I
So
mean, that is
it
the difference between,
motivates.
yeah, that is the
Yeah,
difference between the doctors, for example, who work in hospitals.
yeah,
That if I operate someone or if my colleague operates someone, none of us, I mean, it is mentioned in the operation bearish that
yeah.
we have operated that patient, but it has nothing to do with our salaries.
No, 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 no. Yeah,
So that is the difference. So if once someone treats a patient, his name goes into that register and he will be paid. If there is some such arrangement, he will have the opportunity to earn extra. That is what
yeah,
is.
yeah, yeah. So this depends on what contract you have with your employer, and what terms and conditions you both have agreed upon. It may not start immediately, may not, I'm saying. I know people who have started working directly with this agreement with their boss, that okay, whatever they earn about this, they would get commission. In my case, for example, it started after a year,
Mhm.
when my employer saw, okay, what kind of work I'm doing. And in general, yeah, that's fine. They may
Mhm.
decide that because they are the employers. They would like to see, okay, how much revenue they're generating. Fair enough. So that was like that with me. So the more you work, the more revenue you generate, so you get a part from that.
Okay.
Some dentists don't do that. They say
Mhm.
no, we would not do it, because for example, in my previous clinic where I was, they used to say no, you would work on a fixed salary. We do not have this concept of this commission, because we feel that in that with that, you always try to do more work, and everything, the quality gets compromised, and we don't want that. So there are different opinions here.
All right, all right. And in general, like when then in that case, the salary would be higher, right? When there is no
Yeah.
extra, then they would be
Yeah,
offering.
yeah. It would be relatively the basic salary. May not be. It's
Hmm.
not
Hmm.
like that.
Yeah,
It is a must.
yeah.
It's not like that. It may even be less, and also
Okay.
without Umsatzbeteiligung.
Okay. And so in general, like we had a figure, like say 3,500 as a maximum. This we're talking right after the Berufserlaubnis.
Yeah.
And when one gets into that level, but is one allowed to do this Umsatzbeteiligung before approbation, or is it only
Yeah,
like
yeah, yeah,
after?
yeah, 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 yeah.
One is
For
allowed.
me, for
Hmm.
example, it started all before approbation. Yeah.
Okay. And this Umsatzbeteiligung, so in general, like roughly how much should one expect? Like that, okay, I mean, I understand that's totally flexible, depends upon person to person, depends upon the number of patients one sees and everything. But what is a roundabout that one should expect that, okay, this much one will take home or one will receive in the bank account after Beruf?
Yeah. So uh, that would be difficult to say, Dr. Deepak, because as you said, it's very much variable. Mm. But what I can here say is, you should be expecting the percentage that you would get is about in the range of 20 to 25%. It varies. Some clinics may
Okay.
put it to 20% of the commission to your account, or some to 25. Now it depends. It's always advisable to get your basic salary as high as possible,
Hmm.
and your Umsatzbeteiligung upper limit as low as possible. Right? So
Obviously, yeah.
yeah, so then you have a higher basic salary, and your upper limit is also lower, so that you
Mhm.
can earn more. So if you have a basic salary of 3,500, uh, and you do good work, your clinic has decent amount of patients, and your upper limit is maybe 15 or 16,000, I think, with normal uh, amount of working, no extreme extra efforts, you should be going into 3 or 4,000 euros extra. Like you
Okay.
should be, yeah. So that means about 1,000 more in your account.
Mm.
So
Yeah.
4,000, if you are earning 4,000 more for the clinic, than your upper limit, the upper cap that has been put. So 25% of that, so 1,000 extra you earn. So
Okay.
then there will be taxes, but
Yeah.
that is what extra
Okay,
what you
but
get.
still, in my view, then it is like little less compared to what I mean, my view ought to be, because if you have like 3,500 as or 3,500, you said is maximum limit. If say 3,000 as a beginning salary, why I'm stressing on the salary part is that when candidates want to embark on the journey of getting into specialty in Germany, like working in Germany, they need to know that if someone has a family, a wife, a child, and everything, they need to know that, okay, what is it going to be, how much are we going to make, right? This
Definitely,
is
definitely.
and
Yeah,
this is and for medical part, everything is online. Like one can just Google third year
yeah,
assistant arts, how much is the salary, one can directly, I
yeah,
mean,
yeah,
that
yeah,
also
yeah,
varies, depends upon duties and everything. But in general, roundabout idea one has about dentistry, because it is so opaque system.
yeah.
People don't have this clear idea. That's why I'm stressing on that. Since you are working here, you are the best person to tell us that what is to be expected. So
Yeah,
that's
so
why
I
I'm
would just
yeah.
Yeah, I'm sorry. I just put one example. I know of friends who have a basic salary of 3,000 and they have managed to get 4,000 in hand.
2000.
So
Again, 2000
4,000 euros one in
after.
hand
Okay,
after taxes.
after
I
taxes.
mean,
Yeah,
after
yeah,
taxes. So that means they would have easily got
6,000
their brutto,
approximately.
yeah, about 6,000. So that means that a basic salary of 3,000 and they got 6,000 and their limit is, I think, 13 or 14,000. That means you can just see how much more they have earned for the clinic.
Mm-hmm.
So it is a possibility. It may
Mm-hmm.
not be in someone's case right from the start, but when you have worked 6 months and you actually know you can
Mm-hmm.
work,
Yeah.
then definitely it's a possibility.
So that means that when one says that okay, just beginning first day work and you're working at the basic low, say 2,500 or 3,000 brutto salary, it is not end of the game.
It is not end
Uh,
of the game. Yeah,
yeah, in
definitely.
some time when you gain more experience, you gain trust of those people over there who are working with.
Exactly.
You have your all the licenses, approbation, and everything. Then certainly that like adds to your like strength when you appropriate and everything. You have done Fort Bildung, your skills are good. Then certainly you have a opportunity where you can increase from like say 3,000, 4,000 additionally.
Yeah, yeah, yeah.
So
I know, I have heard of, I don't know even personally, but I have heard of people that even with Berufs allowance, they have been getting 4,000 brutto, which I would say is a very, very good salary for dentists with Berufs allowance. There are people, not to say that there aren't, but we should keep the average numbers in mind because that they
obviously.
would only be a very small percentage.
Yeah. Yeah, I mean, yeah. Okay. So, yes, that is about the initial part. And when one goes further, like after approbation, you have assistant side, right? Now
Yeah,
we'll
yeah,
talk a
yeah.
little bit about the training, and along with the training, the salary increase. So your assistant side, that means you are not an independent dentist. You are under supervision, basically.
Yeah, yeah,
Right.
yeah.
So this assistant side, how tell us something about why is it like, and what is the purpose of it? How does it end?
Yeah, so the assistant side is not has nothing to do much to with your clinical skills. Like I also had this thought that why do they say that you have to be working under the supervision of appropriated sanas? It has more to do with the insurance system. The insurance system here is so complex, and with dentistry like even more complex, I would say, that they say that a 2-year assistant period is required to understand the system and how it works. People say even 2 years are less, but at least for that, but at least, yeah, so they have put a limit to it. 2 years of assistant site is mandatory. After that, you can work independently or you can open up your own clinic.
Okay, so here working independently was that you are your own boss, like you open your own clinic.
Yeah,
For that, you need that 2 years. You should have worked
exactly.
in the system
Yeah,
in as an assistant with some
yeah,
with some doctor as a
yeah,
partner, maybe like not alone sitting in the boss's
yeah,
boss
yeah,
chair.
yeah, yeah.
Okay, okay, that makes sense actually. Like in because
Yeah,
when it's a totally
that's fine.
private system, and then there is nobody to guide you, then it makes sense that you
Yeah,
have to be a manager as well and the entrepreneur as well and the dentist as well. So it makes
yeah.
sense that you understand the system well.
No, the system pretty good in my opinion. You feel also secure as a foreign dentist. You are no new to the system, so definitely you feel okay. Yeah, there is some accountability other than you also. You are
Mhm.
not the one accountable for everything.
Yeah. And there is exam after assistant side, or how is it? How does it
No,
end?
there is no exam. Like once you have passed the approbation, then there is the assistant site. Uh, then after that, there is no exam. One very common misconception there is with people who even are working here. They, I don't know how it keeps coming up. The same issue every time. That the time that you work with the Barus allowance, the 2 years, is not counted anymore as assistant site. It used to be earlier that people also who have worked with Perusa alumnus, they got that counted, and then straight away after approbation started as Angestellter Sana. That means like you can
Hmm.
work on your own basically. It is not the case anymore since a couple of years. Everywhere,
Yes.
all throughout Germany, now you have to. The time is started. The time starts counting when you have done your approbation. After that,
Yes.
it's a very important point to know and understand.
Yes, I mean, I created a course which was like called a roadmap for. I made
Yeah,
one for doctors and one I made for dentists also. And there I have that was course was made in like 2020, and there also I've
yeah, yeah,
specifically mentioned that with diagrams and everything.
yeah.
Maybe
True.
I'll give a link to that where with the diagram and everything, which mentions that that at approbation is the block, that before approbation nothing is counted, after approbation the time is then counted. Yes.
Yeah, so guys, it is very important to have information from the right sources, because so much of incorrect information is floating around you. You actually need to sift through the right information, because I know colleagues who have been working here but still are not clear with the whole process. I sometimes wonder how is it how is it when they are even working here, but I don't know how somehow this thing keeps coming up again and again.
Yeah, so certain things. See, this I face also when my colleagues who are in like who came in with me or after me, like 5 6 years back from India. They when they have queries about Instagram or about the licensing thing for themselves, for their wife, for their friend, they when they are themselves doctors, they're working. They have also gone through the process themselves, but it was like 8 years back. Okay, when we came in
Hmm.
2014 and
Yeah,
15,
yeah,
that time, and now they are not up to date, they have not like
yeah,
followed
yeah,
the
yeah,
trend. That's
yeah.
why then
True.
they forward me the
Yeah.
questions. So
Mm.
it's like that they did that. And then I mean obviously when you are not engaged any information, then
Yeah.
you will not
True.
be aware of the updates what is
Yeah.
happening. So
Yeah.
I don't blame them, just that but then they don't stop, that does not stop them from giving advice. That is the
Yeah.
problem. So
Yeah. Yeah. Yeah.
uh, I mean, they could directly say that, look, I have done it long back. I mean, my time it was different. Now it might be different. Check out the relevant sources. But then everyone wants to give advice. So, I mean, yeah.
Yeah. Yeah.
So, okay. So, moving from the assistant side, after that, we go that, okay, you can do the full, have your own practice. When
Mm.
you have your own practice, what kind of income is one looking at, like approximately? Uh, as a then now this is a business, I understand that
Yeah. Yeah. Yeah.
you have to pay salaries, you have to pay different taxes. So but still what would be, it would take some years to build up the practice to gain patients and everything, but how is it, what is it with praxis Ubernama, how much does it cost approximately, if you have some idea about that?
Yeah. Here I will not be able to be of much information. I don't have, unfortunately. Maybe in coming times, because till now I did not focus myself also on these aspects. But yeah, I some just asked my boss one day about this, that how much did you pay for this Ubernama, and he just kind of laughingly diverted the question. So so when I come to know answers to these questions, maybe I'll share with
All right.
you guys. So yeah, but one thing I can definitely say that running your own clinic is definitely quite profitable here. It's also a very responsible task. You are always on your toes. Yeah, that is there everywhere when you are a boss, and there are many regulations and checkups and so many things which keep happening here in comparison to maybe India. I can put an example, but I guess the best part is that you don't have the stress of whether you will have patients or not, which is the biggest problem in India, which people face. Average clinics in India, I haven't run my own clinic, but whatever I know, if you have 5 patients, 5 to 10 patients, average clinic per day, it's decent, I would say, in India. But here, any average clinic would have at least a OPD of 20 to 30, I would say, per patients per day. The amount of work that it also depends where you are practicing. Of course, I'm just talking about an average clinic, right? So when they are patients, then that is the main thing, right? Then you automatically earn. So running a own clinic here is definitely profitable. Dentistry also comes in all surveys as one of the best earning professions here in Germany, but that is mostly when you are basically having your own clinic, then you are in the top. Otherwise, dentists are getting good salaries, yeah, but then there are other professions too who are earning as good as you.
Do you aim to open your own clinic someday or take over some clinic someday in the future?
Difficult to answer right now. Maybe later.
Because that has to be the ultimate aim, right? Like an
Yeah.
ultimate aim that
Yeah, definitely. It is the aim. You can do that. Then it depends on personal preferences, like, 'cause I am of one of the kind that, okay, I want to do things and not have to bother about so many things and running the clinic and so all that. But yeah, it's not ausgeschlossen, not ruled out.
yes, yes. I mean,
Yeah,
this
yeah.
having your own practice, like since now I have taken my FACAS exam and all, I'm like contemplating about these ideas, or at least
Mm,
researching about these ideas and how
yeah,
is it and all. And it is a very challenging job because
yeah,
I mean, you might think about the profits and everything, but then you cannot do anything apart from that. You are working, like you're basically not owning the business. You're self-employed
yeah,
most
yeah,
of the
yeah,
times.
yeah,
Yeah,
yeah, yeah.
that means you have to go there to work. Like you are go, maybe you may call yourself the boss, but it's not like that you're sitting at home and people are working
No, no,
for
no,
you.
no, no, not at all, not at all. People are really working hard. Like, the amount of patients that anybody's bosses here would be doing. Most of the people is if you are doing 10 patients, your boss would be doing 20 or 30 patients. So they are
Yeah.
working.
And plus after that, when you go home at 4 o'clock, your boss will sit and do all the abrechnung and all the paperwork and accounting and all those things that has to be done.
Yeah,
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 most I
yeah,
mean
yeah,
I
yeah,
mean I know that there will be specialist people who will be doing that,
yeah, yeah.
but still he has to keep an eye on everything that
Yeah,
has
yeah,
been
yeah,
done or
yeah,
not
yeah,
done.
yeah, yeah. So
So
every morning when my boss comes, he looks through the revenue generated last day. It is put on his table, and he
hmm.
looks through that and matches everything. Okay, what the patients, what he has done, and what has been put in the report and things like that. So yeah, there are 100 aspects one has to
So
do.
considering those things, then I sometimes feel that then probably you
Yeah,
cannot. I mean, rather do something else, or
yeah,
maybe go 8 hours duty to some hospital or some place, and then rest of the time is yours, and you can do something else with
exactly.
that time.
Yeah, yeah,
And
yeah,
you that way you have a fixed income. That means that nobody's taking away from you, and plus you have
yeah,
your free time also.
yeah, yeah, yeah.
So
So it's a big engagement.
yeah,
Yeah.
okay. These thoughts, they're very interesting topics to talk about. Maybe we'll have someday other conversation about that. So moving ahead, we talked about the progress of the with Beruf Serlaubnis, with approbation. When one is so ahead that one wants to take over the practice and be the own, like 10 years from now, 15 years from now.
Yeah.
Uh, what I wanted to know more is that the work as a dentist. What kind of work do you see more? Like, I have not much idea about like fields of dentistry, but I get these questions very often from practicing dentists in India. That okay, I'm this kind of surgeon, and I want to come to Germany. What is the scope for me? Or are there job vacancies in my branch? So, do you have any idea about different branches of dentistry? What kind of work is more preferred here, which have less scope?
Mhm. I'll just come to this question, Dr. Deepak. I just remembered one more point. I'll just quickly add it. It's an important one. What we talked about in the last question about praxis Yuvanama. So this problem is get becoming larger and larger in Germany, because there have been surveys where 50% of the current dentist population is in the range of 50. So it's a aging population, and many dentists are finding it problematic in their close to retirement ages to get Nachfolger. Nachfolger means that people, younger generation, who are ready to take their running clinics. Like, the clinics are all fine, they have staff, they are running well, patients. Someone has to just come and start working. But even then, they are not finding people. So this problem is increasing, um, and this problem is even more acute in the relatively rural areas here. So if someone wants to open up their own clinics and they are inclined towards it, it's actually a very good option.
Yes, I
Yeah.
mean
So
it costs a lots of money, but then there are
definitely,
loans
yeah, but you
available.
have all kinds of help for that.
You have
Exactly. And
loans
the best
available for
part, which
that.
I said, there are patients. You don't have to do anything. Patients would be thankful to you that you have come here to practice, and you will have patients from day one. So
Yes,
that is the
that
yeah,
is
that's the best part.
That is that was to related to that was I was going to come to the question that what are the job vacancies like, because many times people say that okay, I have been listening to Deepak Mishra since 5 years now, and in 5 years, so he was saying that time also there is job vacancy, he's saying now also there's job vacancy. Is it really so? Are there jobs still there, or is it so that there are so many dentists and doctors now that there's saturation? What do you think?
Yeah. So we have talked about this thing also in the FSP video. I think I would again put it to it. So I have always kept hearing that dentists, I would just relate myself to that there is no shortage of dentists, and Germany doesn't need more dentists, so no point going there and things like that. But when it comes to hard facts, like on the ground, what's happening? So they need people, as I told, they are not finding people to take over clinics. Most of, as also in India, also in Germany, 60 to 70% of the present dentists are females. So they are either not working full time, or they are like not owning clinics, they are working as employed dentists and things like that. So on the ground, reality is somewhat different, basically in the rural areas. And in the rural areas, you earn actually more. Repeated surveys have pointed it out that rural areas, the dentists are earning more than the dentists in city areas. Just
Okay.
lesser competition, more patients. That's how it is. Like I have read it repeatedly in many articles. Average rural dentist, area dentist has better incomes than city dentists. Yeah.
Okay. Okay.
So
Interesting.
yeah, and the area of work. So basically, they practice all fields of dentistry here. A general dentist here, I feel, a graduate who has come out from the university here, average graduate is uh, is far better equipped than an average dentist in India, I would say, who has come fresh out of the university. They The exposure that they have with dental prosthetics uh, is dental prosthetics is the ultimate aim. Whatever you do in a patient, you do extractions, you do scaling, or you do endodontics, you root canal. The aim is to rehabilitate the patient at the end, and that is what generates the maximum revenue. Dental
Mm-hmm.
prosthetics, rehabilitation. So that they do it very well and very extensively here. That's a part of the university program curriculum. It's pretty extensive. So because of that, I feel they are much more equipped and prepared. We haven't done or heard of things like that during our own curriculum. Yeah, fine, I passed 10 years ago, but I don't know, I don't think it has changed a lot on ground in practical work aspect. So they do everything here. Endodontics, as everywhere, is very important. That means root canals and fillings, cavities. Materials are pretty much the same. The materials that you get in any good clinic or any good dental school in India, you get the same things here also. Everything is there. You may even get something better, better machines or things to work at. In general, average standard, maybe even better than India. So work environment would be pretty good. Like you would get things to work with. You won't
Okay.
have companies on that
Are
front.
there any branches which like in dental specialties which there is no such requirement in Germany, and which is the most commonly practiced like branch?
So Germany doesn't have uh, this specialization culture till yet. Like for example, in India, we have nine specialities in dentistry, after
Mhm.
dentistry. Out of that, about six or seven are clinical branches. So Germany doesn't have like that. Germany, you only have a clinical specialties in two fields. Now, there are others also which are coming up with time, it's changing. But broadly speaking, it's just orthodontics and oral surgery.
Mhm.
So these are the two specialties. Now, slowly, specialties like periodontics is also coming up. A few universities have started masters in periodontics. A few have also started masters in pediatric dentistry. But roughly, you can say there are right now broadly accepted two streams: oral surgery and orthodontics. All of what comes other than this is practiced by everyone. Everyone is doing this. In especially in the rural areas, dentists are doing everything, right from even just BDS to say, like, no post graduation. They are doing everything, right from fillings to implants. In bigger cities, there is this culture of Überweisung, that means referral. Like, there are clinics which are doing specifically just fillings and root canals. They don't go much into surgery. They refer all patients to surgical clinics. There are specific surgical clinics in big cities which are doing only surgeries. They're not doing anything else. They get cases referred from all like neighboring clinics, and they do only surgeries and refer back the patients to their base clinics.
Mhm.
So this concept is there in big cities, also smaller cities, but big cities basically this is more prevalent.
Okay.
So, but in general, the dentists here are doing almost everything.
See, you mentioned about the university courses. I also get several queries from candidates who say that, okay, I want to get into post-graduation curriculum in Germany. Which university is like the best university? I want to be in the best university.
Yeah.
Now, to that question, I get a little perplexed because the what I know is that you don't have to go to university. You have to do the all the process that we do for like all dentists in our consulting. That okay, by the Regierung, you have to send the Antrag for Berufserlaubnis approbation, all those things that you have already done. We have talked about several times. Why would like someone want to go to do a MSc in a dental course in Germany? What is that such? What are such courses? Why is it useful and why is it not
Yeah,
useful?
so basically, I have not much gathered much information about this, but this is pretty much similar to also MSc courses in the UK. Like, it's the same. Like, UK is English speaking, so many people go to the UK for such master's courses, and after doing the course, you cannot practice there. You can only practice there as long as you are in the course in the university. As long as as soon as the course is finished, you have to come back to your home country. So I think there is a common misconception among people that they think that doing masters from here would allow them to work here. No, that is not the case. If you do not have the approbation, you only have a restricted work permit to work in the university while you are pursuing your course. And
Mhm.
as soon as the course is over, you have to go back to your country.
Okay.
You don't have any license to work here.
Okay. And these university courses, they would have a practical tile, like they be there, they would have a temporary license, something. But then, without, if someone does not have German language, no Berufserlaubnis, how would they be allowed to touch a patient? Like, I don't see that happening.
Yeah, so then there is this thing that even Germany has also started in some universities to they are proposing courses in English, these
Mhm.
master's courses in English, where there is no, they say that good, if you know some language, it would be helpful to you, but it is not mandatory. They have just started in some few universities. I cannot recall the names right now.
Okay.
So it is that. So it's in English, so you can do that. But again, the limitation that as soon as you are done with it, you have to go back.
Okay.
And the other thing is, when they are costly, they are pretty much costly. They cost, for example, I can tell you about oral surgery. There is a course for oral surgery and implantology. It costs more than 20,000 euros.
Okay. Okay.
So
But my idea is like I have not researched about this field much, but my general concepts in doing this consulting, it's been so many years now. My idea is that you don't have Berufserlaubnis, you cannot touch the patient. So that is what, and to have Berufserlaubnis, you must have done the language. So someone who
mhm.
just says that because that was the part in the Regierung, like maybe say you talk about Bayern or NRW, anywhere, language was mandatory. So that is that this is something similar to fellowships that they say in medical field, that they say
Yeah.
that you do now you have done orthopedics in India, now you go for do spine fellowship in Germany. They come for 3 months or so, they do fellowship, but then they don't touch a patient. They see and they learn and everything, but they don't have a license. So
Hmm.
this thing I think we should clarify that
Yeah.
do those MSc courses, that master's courses, what is do they work as a dentist? or they
Yeah,
just do practical?
as I gathered, yeah, they work, they do work on patients, but as said, under the protected university environment, under the guidance of the tutors and all. Like they
Okay.
would be working on patients, but under the guidance of tutors and not allowed to touch patients alone or things like
Okay,
that.
okay, okay.
This
As a
is what I
student,
gathered from my, yeah, as a student, you can say, yeah,
okay, so okay, yeah, then they come under the student category. So
yeah,
students can
exactly,
are allowed, like medical
yeah,
students also who don't have license, they are allowed to draw blood and examine patients
yeah,
like
yeah,
student.
yeah, yeah.
Okay,
Yeah.
okay. So as a student, okay, that means they cannot work anywhere outside of the university, only a student in the
No, but
university.
many people do this, these master's courses to get a feel how people work here, to also get better with the language and patient exposure. So people who have decent amount of money pursue such courses, and parallelly they also keep trying for the approbation. So
Yeah,
I have
that
come
that makes
across.
that was my I was coming to that only, that for someone who is not limited on resources, that makes actually quite a good sense.
Yeah,
That for that you have a student visa, then you are here for 2 years.
yeah,
If you do that for 2 years, you have a master's degree, then German masters. That will definitely help you
exactly.
in employment and
Yeah,
further growth and everything.
yeah, true.
But then again, that thing is that then you are booked for 2 years.
Yeah, true.
That
Yeah,
means you cannot do, like say, hospitation, or you cannot work till 2 years. So you have to
no.
be ready that I'll pay the fees for the university course, and
Yeah,
plus I will be leaving my opportunity cost. That means I will not be working for those 2 years.
no, no, no. Yeah,
So, and even
yeah,
though when one can get a Berufs Erlaubnis approbation, so that will
yeah,
become
true.
little tricky. This happened to one of our consulting candidate, not dentist, a doctor, who came on a student visa for such master's course, and later on when he got his Berufs Erlaubnis and everything, but still his course was like 8 months pending.
Mm-hmm.
So he had a job offer from one of the places like in anesthesia, and since his course was 8 months more, we talked about it, like what should we do. I said that, I mean, the choice is very simple. Either you say that this course is not very useful for me, I'm not going to use this. Was doing some therapeutic, something non-clinical thing,
Mm-hmm.
something. So dance therapy, something. I called it dance therapy. It has a very scientific name, but I
Ah,
called it dance therapy.
uh,
So he was doing that. I said that, would you use it anytime in future in your life? He said no. But then why do you want to like pursue it, and why don't just quit it and do your like, you have a job now, you can start working tomorrow, and you
mm,
can start earning money. But then his point was that, okay, when I have already spent like almost more than a year here, I spent paid the fees and everything. I would rather do 8 months more, get that degree, that I have
mm,
some university degree from Germany as well,
yeah,
and
yeah,
my entire 1.5 years is not like totally wasted.
yeah,
And there's work I can do later also. It
mm,
makes sense. I mean, they're both opinions. One can
yeah,
choose what they want. So and then so this thing, one has to, when do do master's course, one has to remember that that 2 years you are going to be booked in that master's. So
yeah,
if that
yeah,
is worth it, then one has to think about that.
yeah, true.
Yeah, yeah. Okay, okay, wonderful, wonderful. So, okay, yeah, we have covered quite a lot of things. What normal dentist in a foreign country would want to know about coming to Germany.
Yeah.
Who is? Do you have any other thing that you would like to share with people who are in that pathway to like send documents, prepare plan? What things are important? Any other thing that apart from what we already talked about?
Yeah, so have lots of patience. It takes time. uh, Anybody who has started on this path that knows it, don't there will be times when you would be frustrated or going through different stages, but yeah, all that will pass, and you will cover one milestone after another, slowly, one after other. So just have patience. Having patience is the first and foremost thing what you can do for yourself in this journey. uh, and rest, everything will fall in place and come with time. So, and keep following Dr. Deepak's YouTube videos. I would definitely add to it again, because this is information which is actually uh, distilled for you basically after years of experience. uh, so don't worry, keep working, and all will be good.
Thank you, Dr. Vikas, for such kind words. Yeah, we work on the goodwill of people like you who are doing in the field, and you share. I mean, where do I get my information from? Right, I get my information from people like you. Like I talk to you, you tell me, and that information then goes to via YouTube channel to so many different candidates, and people have also showed their support and love. They like our channel. I mean, most of I will be very blunt here with my audience here that most of the things are transactional, that they want some information, and that is what they write in the comment, that okay, this is what I want. If you have it, you give it. If you don't have it, then leave it. Like, it's really transactional. We try to accommodate those transactions as well, but abunsu, like here and there, some good comments, some nice appreciation also like motivates us to work for the.
Definitely.
All right. Then with this, we'll conclude this video here itself.
Yeah.
And dentists or dental aspirants, dental students who have more queries, specific queries, can write on the comment section of this video, and we will answer to them. We have also talked about the approbation exam preparation strategy or material, a PDF of which we'll be sending. For candidates who sign up in our forms, you just have to write your name and your email ID, and we will collect all those email ID. May take a couple of weeks, and then once we have the entire email ID thing, then we will be sending PDFs at once. Not that every day someone writes and every day we engaged with that same thing. I'll have to hire someone for that then. So that will be too much work. All right, then. Thank you very much, Dr. Vikas, and I wish you a very successful career ahead. And once again, congratulations from me and the entire team of 10 Minutes International towards your journey in Germany.
Thank you. Thank you.